don't we get started with the presentation? So hi, everyone. I'm Scott Allen. I'm a CEO for the Family Medicine Education Consortium. And I'm going to share my slides for just a minute and give a little bit of background. But welcome and thank you for joining us for the first in a series of seminars based on our annual meeting 2022 sessions. We are talking today about family medicine pathways to health policy, a conversation with former health policy fellows. So thanks for joining us. Just a little bit of background about the FMEC. We are a catalyst, convener, and incubator. We cover basically the northeast corner of the US. It's about 14 states and DC. So from Ohio east and to Virginia's north. And we do a lot of work with the medical schools and the residency programs in the region, promoting family medicine as a career path for medical students, supporting residents as they transition in their careers, holding our annual meeting, which includes a lot of opportunities for speakers, especially for junior faculty and residents. And then we do some quality improvement initiatives outside of the annual meeting and some other activities like this webinar series. I just want to promote quickly that the 2023 annual meeting is coming up in October, and the deadline for submissions for presentations is February 13th. So please visit our website and you can find all the information you need about how to submit a proposal, and all the different types of sessions we have are listed on the screen. So with that, I'm going to turn it over to our speakers today. I will let them introduce themselves, but we have Emily Ha, Madeline Taskier, and Jill Willis today, and I'm very appreciative of their time to repeat this session and hopefully get some good conversation going with you all as the attendees. So with that, I'm going to turn it over to Dr. Ha.
Hi, everyone. So I'm going to share screen, and thank you so much to FMC for having us again. Originally we had this talk at the annual meeting, and it was such a wonderful opportunity to engage with students and residents who are all interested in health policy in the long term. So from our perspective, we're actually all in a way junior faculty, and I think that's something that's very unique when we talk about next directions and next steps for trainees who want to get more involved and balance a career that not only sees patients but could potentially make greater change in the policy sphere. So Scott did a great intro, but we'll each talk a little bit about ourselves before we dive into some questions that we came up with that might interest you, and then also open the floor to general Q&A too. So my name is Emily Ha, as previously mentioned. I am currently an assistant professor at GW, which is out in DC, and I was a previous health policy research fellow at the Center for Professionalism and Value in Healthcare, and this is an arm of the American Board of Family Medicine Foundation that is located in DC, focused on mainly policy outcomes and workforce development for the ABFM's interest and advocacy in that space. And you'll see a running line in that you're actually having fellows from various years from that program come speak to you today in today's panel. My story is actually not someone who always wanted to do policy work. I thought I would be a general practitioner and do family medicine training work in the private sphere, really wanted to give back to my community. But one thing that really shifted was I trained during COVID. So I was the second year when the pandemic hit, and got to witness this overall, the vast just inadequacies of the healthcare system, of access to vaccines, of just patient care and knowledge of the pandemic. And it really hit home when my own family was affected by the virus. And so as an individual who kind of witnessed these horrific experiences firsthand, I wanted to take that opportunity to see how I could make change. And one thing I realized is that we really need more physicians to have a seat at that table. And so I pursued a year fellowship with the ABFM and at GW to be able to learn more about policy, since I never really thought about it before. And so I really give kudos to all you have joined today, because that really shows your interest and is such a powerful first step. And so during my year, I got to work with a nonprofit organization that serves as an umbrella for FQHCs, for Federally Qualified Health Centers, involved in immigrant issues, especially for the Asian American, Native Hawaiian, and Pacific Islander experience, which I was very much passionate about. And also got to do some work about the primary care workforce too, which I in turn am channeling forward by getting more involved in academic medicine these days. So happy to be here, and that's a little bit about myself. I'm going to turn it over to our next panelist.
Sure, I think that's me. Emmeline and Madeline, can you guys hear me okay?
Yeah.
Yes.
Okay, great. So yes, Emmeline, awesome introduction. Thank you for that and explaining a little bit about the Center for Professionalism and Value in Healthcare, where we all did a fellowship. I am originally from Illinois. I was actually a PA in the past, a physician assistant. That's related because I think when I was working as a PA, I began to see a lot of concerns, and as Emmeline in healthcare, and as Emmeline mentioned, kind of wanted a seat at that table for making a positive impact in the future of healthcare, and thought that going to med school would be the next logical step from there, and an interest in health policy spawned from that. Did residency at Cleveland Clinic, and while working at Cleveland Clinic, again, all those interests that I had when I was a PA in several topics, including community activism, kind of realizing when I worked as a PA that there's so much more to medicine than just what's happening in my office. When I'm seeing a patient there, and that so much of that healthcare is happening outside, and just realizing that in order to improve conditions of healthcare, more needed to be done. And so went ahead and applied for the fellowship in DC, and I was the inaugural fellow when the facility opened up. And as Emmeline mentioned, it was actually right when COVID was going on when I was doing my fellowship. And so there was a lot of teleworking happening all of a sudden. And in that space, I found myself involved in a couple of different places. The NIH is one, National Institute of Health. I think what you're going to get is there's lots of different opportunities, as you heard Emmeline describe some of the things that she was involved with. If you're interested in the health policy space, there's just so much to be done and that can be done. And so at the NIH, I worked with the National Institute on Minority Health and Health Disparities on issues related to Latinx populations. And also during my time, another interest of mine was in diagnostic error. And I worked at the Agency for Healthcare Research and Quality, acronym is ARC, with the Center for Quality Improvement and Patient Safety. And so those are the two places I spent most of my time when doing my fellowship. And I'll go ahead and pass it along to Dr. Tessier.
Hi, everybody. Can you hear me okay?
Yes.
Hi, I'm Madeline Tasquier. I'm a family physician, as you all could probably tell. I'm the current CPV GW Health Policy Research Fellow, and I'm coming to you live from Lexington, Kentucky, where I'm here for part of the week at the American Board of Family Medicine headquarters, which has been a really wonderful trip and crystallizing a lot of the sort of research work that I've been doing. So my background is originally in public health. So I was a public health and anthropology major undergrad. I worked in women's public health and at a sort of nonprofit advocacy organization coming out of college for a while, spent some time in that space, knowing that I was really interested in health systems and understanding what are the structures that influence healthcare and the overall population health, specifically for women and at the time when I was working there. And then as time went on, I realized I wanted to have more patient contact care. Obviously went to medical school. I went to medical school at George Washington University in DC, which is my hometown. But it was always kind of buried in the back of my mind that I wanted to have a future clinical career with some sort of access to understanding health systems, the issues that I cared about, and the ways that I would change structures, or I could change structures, and understanding those interwoven policies that really make a difference in how we practice medicine and how we deliver care for our patients. And I was wrapping up residency. I was a PGY1 when the COVID pandemic hit. And I think at that time, I knew that I wanted to do some sort of community practice and continue to be a clinician. But like Dr. Ha and like Dr. Willis, noticed a lot of structural inequalities, tons of different issues and frustrations that clinicians were facing and that patients were strained with issues of access and equity, and knew that, hey, I got to really develop some skills and learn how the system works to make it work better for my patients. And that's what sort of led me to this health policy fellowship. Luckily, I had the mentorship and the great connections to my colleagues who were, also friends, and they very much introduced me to this opportunity, saying that it could be crafted into an experience that really met my interest and allowed me to sort of pursue what policy space I wanted to be in. So what I'm doing right now is a mix of obviously policy work and research. My placement is at Health and Human Services, or HHS, in the Office for the Assistant Secretary for Health, OASH. And I work specifically on the initiative to strengthen primary health care, which is a cross-agency, sort of federally coordinated initiative to figure out ways to strengthen the foundation of primary care in this country, which is a really big ask and quite a big task, but there's a pretty strategic approach that we're going for right now. It's still pretty internal, so I can't speak in a whole much more detail, but it's a lot of the work that I'm doing within that space is in integrated behavioral health within primary care. So how do we create a comprehensive mental health and behavioral health home for patients when there are so many issues with access and such an increased prevalence of mental health issues in this country? And also a lot of my research through the ABFM and the Center for Professionalism and Value has been around reproductive health and access to reproductive health care and comprehensive women's health services provided by family physicians. So I'm interested in those workforce issues as well. So from that, I think that was the sort of brief intro, but I think we could probably transition to some of the questions we prepped.
Sure. So our first question that we brought up for the group is, what health policy issues should early career family physicians be paying attention to? So Dr. Willis, why don't you take us?
Sure. Thank you for that. So without hopefully not sounding too simplistic when answering this question, or maybe even too broad, actually, I should say, is I think the answer to that is, best put with what you feel passionate about, quite honestly. I mean, there are so many issues. Healthcare and primary care is a rendezvous place for economics and technology and politics and law and crime. And, whatever issue I feel you're passionate about or what you're thinking about now, jot that down. Maybe it's just residency education. Maybe it's just medical school education, but jot those thoughts and ideas down. You may not have time to be focused in on those things right now because of your busy schedule, but you can return to those. I found myself involved in things like that, where there were issues that I wanted to think more about, read more about, understand more about, and certainly didn't have as much time in residency to do those things, due to the demands of the actual residency program. But however, write those things down and then return to them. That was, again, part of my interest in doing a health policy fellowship, was getting back to those topics that interested me. And I'll just be specific for me right now. One thing that I'm currently focused in on is telemedicine and the impacts of telemedicine. This is a brave new world we find ourselves in as primary care physicians. Telemedicine has been around for a while, but not necessarily in the context with which we're seeing it now due to the pandemic. And how do we do it right? What are the best practices for telemedicine? I'm sure some of you, on this call may be doing telemedicine. How do we prevent diagnostic error in telemedicine, right? We don't have answers to these questions, and I find that fascinating. So that's a topic of interest of mine now, and something that I'm working on with some mentors from Cleveland Clinic, where I did residency, but also with some others. And we've published some things and continue to work on that with medical students at GW, George Washington University, that I'm affiliated with. So I'll let some of our other panelists add some things to this as well.
I completely agree with Dr. Willis. It should be things that you're passionate about. mental health and access to behavioral health care, incredible big passion of mine, as is comprehensive reproductive and women's health services. So I've been following those issues, and I think they're particularly salient and relevant given the current political situation that we've been experiencing in this country. I would say there are a couple of core issues that I think are really helpful and relevant, because they're going to not just be relevant within a policy space, but really in the way that you practice medicine and in, as you're entering an early career, whether it's in policy or not. Knowing structures of payment models, like it sounds very unsexy to some degree, but I think knowing, how does Medicare work? How does Medicaid work? What is value-based care? What is fee-for-service care? Understanding where sort of the policy landscape stands in that, in that corner. What is the federal government invested in exploring what kind of innovations are out there, right? I think knowing how those payment structures are going to influence your practice might get you excited about some of these innovations that may change your practice 10 years down the line, or may lead you to a different practice setting where they have an innovative practice model where you're seeing a smaller number of patients, but you get to spend a lot more time with them because you're receiving, a capitated payment for seeing X number of patients. I thought, this was probably, as I said, the least sexy, exciting thing that came up to me as I started this fellowship, but also as I have gone through it, and I'm halfway through at this point, realizing that it's one of the most important issues that's coming up for especially primary care physicians, understanding how the work is valued and how we can make it sustainable within the healthcare system. So that's something I would say an important thing to pay attention to, and at least educate yourself a little bit on before going into this space.
Great. So our next question is, how can students and residents get involved in health policy, and what are the easiest ways to engage with health policy work? So I'm going to go first. And, as a recent resident, I mean, it's only been 2 years ago since I've been in your shoes. Like, I have to admit, it was a very busy time. And so focusing on, that learning gap from medical school to actually practicing medicine was pretty huge and at times daunting. And I think the easiest way that I was able to stay tuned was being involved in professional organizations. So the AAFP, the American Academy of Family Physicians, Society of Teachers of Family Medicine, STFM, FMEC, which we're currently presenting for, are all wonderful organizations because they really help gather information and gear it towards a way that's really tangible for students and residents to engage, right? So all the newsletters can be very focused to topics that might be interesting to you, and also events that you can attend. Also within each AAFP, there's a state chapter, and I think getting involved in that is really key because it connects you not only with family physicians in your local area, but surrounding clinics, surrounding spaces. And so it's an opportunity to network, but also understand what are the issues that your patients are facing. And lastly, at an institutional level and local level, I think that's the most tangible place too. So whether it may be at your medical school or at your residency program or hospital that you're training at, there's definitely some issues that you can raise and get behind to make positive change, and I think speaking up and being a forefront, since you are a member of that institution, is so important. And that's a place that can really get you a foot through the door and gain that experience in advocacy and leadership. Lastly, in terms of local environment, I think city government is really interesting. You'd be surprised how much power they actually have over patient care access, and just things like within their jurisdiction of just how it affects the people that live in certain areas. And so look up who represents your area, and if they have any open meetings. You'd be surprised that so many meetings are now on Zoom, so you don't even have to drive down to City Hall or anything. You can just listen in. And one of the most meaningful opportunities that I had when I was a resident was in our city, which is San Jose, California. I trained at Stanford, and they were talking about opening a jail and how it would kind of affect the local area. And a bunch of us bunch of us residents came out as San Jose physicians and spoke our views of how this is going to affect the healthcare for incarcerated individuals, and just that impact that you have because you are someone that kind of faces the population firsthand can be really big. And so I think that's some very untapped spaces that oftentimes only a few people look into, and you can really make a big difference.
I'll just expand upon that. So thank you for that, Dr. Ha. Certainly, so Dr. Ha mentioned sort of city involvement, but state as well. Your state usually has different work groups involving organizations. You know, I know my state had a chapter. I did my residency in Ohio. They had a state chapter for family physicians, and I found myself getting involved with that as a resident. And, you know, similar to what Dr. Ha was saying, I mean, they were working on all kinds of issues that involve things that I thought were important for the future of family physicians. And certainly their focus was on Ohio, but there was a lot of federal legislation that was also a part of that. And so getting involved in ways like that could be excellent, as well as I'd encourage you to look for, you know, if there's something that you're interested in and you research it and you think there's not enough being said about it or talked about it, go for it. You know, gather up some other interested individuals around you, some other med students or other physician residents, and, you know, fight for that issue. You guys have a strong voice. You're our future leaders. And I think that a lot of people are interested in hearing what you have to say. So taking advantage of that is you know, to your favor. So, you know, be looking for those opportunities.
Maybe a big piece of that also just to add on is I feel like 90% is just showing up, right? Being there and showing up for those opportunities is going to be so pivotal because you don't know what you miss out on if you aren't there, right?
Thank you for those closing statements, Dr. Taskier. That is definitely key. And so our final question to the group is, what key health policy resources would you recommend for student and residents to use and learn from as they look and move forward in their career?
I can take some of this. I think there's multiple different resources in different mediums that you can utilize to enhance your policy knowledge, access, et cetera. I would say one of the big ones that seems fairly obvious, but it was extremely helpful are podcasts. I find that there are a couple of podcasts that I really insert you right into the heart of what's most relevant in the policy space. I really like the Kaiser Health News, Health Wonk Shop. That's a great podcast. There are several, you know, policy organizations or think tanks that are doing wonderful research and even policy briefs and highlighting some of the key issues that are going on in healthcare right now, but maybe even some that are on the back burner that really do warrant exploration. So the Commonwealth Fund, the Milbank Memorial Fund, Kaiser Health, which is extremely thorough in looking at structures of health policy. Those are wonderful resources. Yeah, I think those are some of the ones off the top of my head. Dr. Ha, Dr. Willis, other ones that you turn to quite frequently?
Well, I just plugged the CPV, the Center for Professionalism and Value, has a website with a lot of great information on it. And also the Robert Graham Center, which is located in DC and is sort of the think tank behind the AAFP, the American Association of Family Physicians. And so both of those places are good resources as well.
Yeah, and building off that, you know, they're geared for family physicians, and they both have opportunities for electives and rotations that scholars can come and spend time to do that type of research. So whether you're a medical student or a resident, that's a great opportunity to take 2 to 4 weeks, look up something that you really care about, get involved and meet some individuals that are making that type of change here in DC. And obviously we all have been part of the fellowship, but that's an opportunity too, is that, you know, the CPV has this health policy research 1-year fellowship that you can complete after residency or even mid-career if it's something that interests you. along with several other organizations that do have, whether it may be community engagement or policy focused training opportunities that you could apply for and spend some extra time that's more dedicated in terms of schedule and balancing your interests. So we want to take this, final 30 minutes just for us to engage with the participants and answer any questions that you may have, and whatever it comes to mind, we're happy to share, and hope that we can kind of have a conversation to help you get more involved in health policy in the future.
Great, thank you very much. And for the people on the attendee group, if you want to raise your hand, we can unmute you, or you can type your questions in the chat. So please ask our panelists about their experiences. And I do have one quick question, maybe before we get started with their questions. I just wondered, in your fellowships and your experience, was there something you were able to accomplish or start to get accomplished that you're really proud of, and then maybe something that you really wanted to do, but politics and policy is difficult, so it maybe didn't happen while you were working on it?
I feel like that's a question for you, Emmeline and Joel, because I'm still in the middle of it.
Well, I would say that right after I finished my fellowship, I applied to the American Board of Medical Specialties and was lucky enough to be awarded a fellowship to the ABMS, or the American Board of Medical Specialties, and they had not had a family medicine physician fellow. This is a program that they do every year, and they have had a lot of the other specialties, but never a family medicine fellow. So myself and someone named Allison Hofstetler, another family doc, also received that award as well the same year. And my focus again was on telemedicine and how we do that better with primary care and avoiding diagnostic error. And so I was pretty proud of getting that opportunity, and then ended up publishing a paper, like I mentioned previously, with a mentor at Cleveland Clinic and another sort of expert in diagnostic error named Gordy Schiff at Harvard. And that was something I was proud of. And then of course, Scott asks, what didn't I reach? All the rest, fixing healthcare, right? Like solving all the issues faced by in primary care, right? Like I want it all to be better. Some of what you've heard described earlier. But I think that involves, again, having a good understanding. There's so many issues, and it can seem a little overwhelming, but as we heard from, Dr. Taskier, getting a sense of what's going on, getting the facts, figuring out the payment structures and where the problems are, figuring that out, it gives you a leg up on where the problems are and how we get there. But I think it's ultimately for me, it's finding a way for the U.S. to support primary care with more funding and more resources than it currently gets. I would say that would be the thing that I'd like to solve, and slowly working towards that with the excellent panelists, as well as Scott himself that you see on this call.
Yeah, I think I was most proud that I just took that opportunity, to be honest, to do something that I never really thought about before or expected that I would be in. I wasn't an MPH person, never really studied anything in public policy or really followed much of the greater news or policy briefs or anything like that. I was just a normal resident going through her training, and just really wanted to take the time to learn. And so that's key, is what Dr. Taskier brought up, is that you have to be there to be able to know what's going on. You have to have yourself have that open mind, that open opportunity. And so that's what truly felt for me the most impactful experience of my fellowship, is that I got to expose myself in an environment that allowed me to grow and learn so much and engage and get more of that experience so that I could move forward. And so obviously there's so much you want to change and so much you want to do, but that's something that we're going to continue to build together. And that's what is exciting about a session like this too, is everyone here is really much passionate about it and hoping to do that too.
Yeah, that's great. And just to go back to Dr. Willis's comment about, you want to change healthcare, you want to make everything better for everybody. And the fact is things move slowly, right? Policy and politics move very slow. And I've worked with many health providers, doctors, and others who got involved in advocacy and really wanted to see that bill get passed, or really wanted to see that budget, double for whatever it was. And that didn't happen, but we took kind of solace in the small wins, right? Maybe you got somebody else to be a supporter. Maybe you educated somebody about something, and that in the future they'll think differently about it. So you can't shoot for the moon. You got to take the wins that you get, and sometimes they're slow, but they're really important. It all builds to where we're trying to go.
Mhm.
Any questions from the attendees? Dr. Willis, Dr. Tasker, Dr. Ha, do you have anything else to share? Any other tidbits, experiences you want to let the group know about?
I think one piece that is important to, or would be helpful possibly, is I think the title Health Policy Research Fellow. Oh, sorry, I have to sneeze. Excuse me, I'm so sorry. I think health policy, the title Health Policy Research Fellow at first very much intimidated me because I didn't have a research background. I'd had some basic background in qualitative research analysis as an undergraduate and in my early public health career, but hadn't had formal MPH training or anything of that nature. And I think what's really helpful in being in a fellowship of this nature is that you have a lot of mentorship and connection to individuals who are going to help you either gain those skills and analysis or just help you with the analysis. They do this all the time. So it's the notion that they can help you frame your hypothesis and your research question. They can help you think through the details and narrowing down what you're really trying to ask about the healthcare system, and help you craft a better sort of scientific question, and help you work through that. I found that working with a lot of different individuals who've had a variety of research background has really broadened my ability to be a better clinician, but also researcher and inquirer and even an advocate, to be narrow and clear in communication. The fellowship offers you that opportunity to engage with those folks and gain those skills. And I don't think I would have gotten that in a lot of other situations.
And I would just go back to something I said earlier, but just, what you find that you're passionate about, follow that. And again, if you can find the resources that help you feed on that, go for it. And if you can't, then create them. We need you guys. We need future leaders in family medicine that believe in making change and coming up with policies and resources that can help us to solve some of these big problems. And if you're on this call, you're one of those people. So think, act locally, think globally, and I fully believe that you can make it happen if you're passionate about it. And I left my email in the chat. Feel free to email me with any questions, and if I can be of help, I certainly will.
I can't say it any better than that, Dr. Willis. So thank you so much to the FMEC for having us again. It's been wonderful to engage with you all, and certainly look forward to connecting in the future.
Great. Well, thank you all three. I think this is really valuable information. I would encourage people to think about what Dr. Willis said. If there's something you're interested in or passionate about, reach out. And groups like FMEC and AFP, we can help you figure out who else is working on those, and we can connect you. There's always somebody. You're not the first person to see it. So let us know, and we'll help you find the people that are working to make change. So with that, I think we will wrap up. Thank you again to our 3 panelists, and hopefully some of you can join for the rest of those seminars in this series, and have a great rest of the afternoon.
Bye-bye, everybody.
Thank
Take
you.
care. Thank you.